This pandemic has revealed really many systemic weaknesses, if I were to say, in our industry. Well, there are 5 of them that come to my mind. First of all, I think it has revealed that we have a weak primary care infrastructure in many of our countries. In the earlier days, there used to be family physicians who people would go to in their physician offices and get their primary care, which meets around 60 to 70% of the care need at any point in time for an individual. However, over the last few years, we have seen those physician offices being consolidated into large hospitals, which makes sense from a infrastructure synergies point of view. But when we are in times like this, where pandemic is raging through the community, such places of care, namely hospitals, even become risky and the places of contagion themselves. So I think one of the main things we have seen is not having a distributed primary care infrastructure really hit us hard in the beginning of the pandemic. The second weakness, which I believe which got really highlighted, was lack of investment in public healthcare infrastructure. Let's face it, in many of our government healthcare for last decade was seen more as an annoying cost factor rather than an investment into the well-being of the community and for the efficiency and effectiveness of the economic output of the country. What has this led to? This has led to our public healthcare infrastructure, which is serving large part of the population, clearly underprepared for technologically as well as infrastructure-wise for facing such a pandemic. The third topic, which I have seen making a big impact in this point in time, is also lack of coordination and capability in the healthcare institutions to manage a pandemic through a cross-institutional collaboration. What I mean by that, if you think of most of our hospitals and health systems, rightfully so, they have been structured in the hierarchical structure coming out of 19th and 20th century, which are okay when you have to work within the walls of a particular institution. But as soon as you are faced with such a pandemic, which requires fast and efficient collaboration between multiple institutions on a daily and sometimes hourly basis to make sure you can take care of the community in an effective way and stop the spread, I think the communication channels were simply not there. And it took some time, even within an institution, to be prepared for such an influx of patients, to have right infrastructure, technology, ICUs, nurses, doctors available to take the situation under control. The other one, which the fourth factor from my point of view has been the lack of disease surveillance infrastructure. What I mean by that, look, pandemics have happened before, so this is not the first pandemic that the world is facing. However, something is very different this time. We are in a deeply interconnected world. And in this world, we have seen what this deep interconnection does to the speed at which this pandemic spread. I remember vividly, end of December 2019, we were talking about a pandemic or a start of such a disease in Wuhan in China, and it felt like it was distant and it would probably never come beyond Asia. And what happened, in just 2 months, not even 2 months, I think 1.5 months, we started to report first cases already in Europe, and by already in few months it was a full-fledged pandemic. So we have interconnected the world, but we have not built the infrastructure to monitor such a spread of such contagion, which can cross the borders effectively due to the mobile population we have. And I think this is something we have to build in order to be prepared for next such pandemic, which is evidently going to happen. It's just a matter of time. Last but not the least, the fifth weakness is the interdependency of the healthcare supply chain, or I would even say imbalance of healthcare supply chain. You see, Christian, in the beginning of the pandemic, we have seen many countries suffering for even not having adequate PPEs, protective gears, to support their caregivers and the institutions. And I think this is the time for us to look at where are those critical infrastructure and supply chain elements needed for our healthcare industry sitting. Do we have control over them? That doesn't mean, I want to be clear, that doesn't mean we want to roll back on globalization. Globalization has a lot of benefits and has given us the speed and scale which we would have never gotten. But we have to now again look at some of these parameters about our supply chain and see what needs to be within the national boundaries, built locally in order to support the institutions during the time of such pandemic. Because as I said, this was not the first and this is not going to be the last pandemic in human history. What we have to do now is to take our hard-learned lessons and act on it.